more recently, we mentioned this in the outset, you testified at the HHS Vaccine Advisory Panel, and it's near and dear to all of us because we're in the face of a pandemic. Vaccinations are front and center. Uh, what is the impact? What have you seen? Can you tell us some of the conversations that occurred in your testimony?
Sure. Well, two interesting things about vaccine refusal. The World Health Organization has put vaccine hesitancy as one of the top threats to public health. But what people don't realize is that needle fear is very intimately tied to vaccine refusal. Anna Taddeo in 2012, which was right around when we were doing our studies and we're like, oh my, this fear level is off the charts. What's going on? She found the same 63% of kids afraid of needles in her study. But she also talked to the adults and found that 24% of the parents were afraid of needles. And of those, 7% said they weren't going to vaccinate their own children. So subsequent studies have found that about 50% of people that say that they don't trust vaccines actually don't like needles. They'll take an oral vaccine, but they don't want the needle. And so it's a little easier to say something feels wrong about this when it's really that you're getting hurt, which obviously something feels wrong. The problem is that now we have 20% of people who say they won't get the COVID vaccine, 17% who say they might not, and a number, about 40% of adults who don't come back for the second vaccine when you have a 2-vaccine series. There's been a lot of work done with adults giving blood trying to predict what goes into the decision to come back a second time. So with all of that together, you have about 67% of the population who may or may not get 2 doses of the vaccine.